Dermafill is a special product that will revolutionize the care of wounds, a common issue in combat and high-risk situations. It is mainly recommended for minor burns, ulcerations, deep cuts, and any skin lesions, and has no adverse effects whatsoever. It is important to stress that all directions for personal use are aimed at emergency situations, which are common in military environments. However, it is essential to have a follow-up procedure by a health professional. Are you ready? So let's go! Dermafill is very convenient for distribution in military bases. It is easy to store and does not require any special care. Dermafill is also compact and highly portable. It comes in two sizes and they both can fit in a small pocket. Dermafill can be applied right on site where the wound occurred. There is no need to move the soldier back to the base. You just wet the wound with water from a canteen, then apply the product to the wound using light pressure. No additional coverage is required. However, if it makes you feel more comfortable, you can cover it. Dermafill helps wounds heal because its physiological structure is similar to human skin. It is the world's only biosynthetic curative care that imitates human skin. This artificial skin reduces the treatment time for severe burns by half, allowing patients to resume their daily activities almost painlessly. When applied to a wound, it completely adheres to the lesion within minutes, working as a perfect temporary skin substitute. Its small pores prevent microorganisms from entering, though it allows the tissue to breathe. It also filters 100% of UV rays. The most important thing is that the dressing doesn't need to be replaced. A great advantage in case of severe burns. When healing is completed, the membrane dries up and falls off, ensuring less scarring. Our soldier has got a second-degree burn and would have been put out of combat. But when we applied Dermafill to the wound, his pain was immediately relieved. This happens because the pain is caused by the lack of skin. Applying Dermafill to the wound, the pain is eliminated, so there is no need to take painkillers. It is quick and easy and allows the burn to be treated right away on the spot. That's why your recovery time is much faster. Another example is this superficial gunshot wound. By applying Dermafill to the wound right on the spot, the bleeding could be stopped so that the soldier can return to action. You see, Dermafill displays some very interesting properties for daily use.
This artificial skin reduces the treatment time for severe burnings in half. Now John, it is important to stress that after first aid with Dermafill, there should be a follow-up with a health professional. This is essential for the result to be even more effective, for the patient can require the use of antibiotics and other medications.
Thank you for your attention.